Well, good morning, good afternoon, and good evening, wherever you are in the world. Thank you for joining the Gussie's Gut podcast. I'm very happy to be joined in California by Dr. Jyl Rubin. Hey, Dr. Jyl.
Hi.
Well, Dr. Jyl, I'm going to do a quick intro of you. So Dr. Jyl is very, very passionate about the microbiome, which is one of the big reasons I wanted to speak to her. She does all sorts of things from she's a mobile vet to she trains other vets, and she's a very big advocate for ozone therapy, which is a favorite of mine. And so we're going to get all into that, deep into her strategies for gut health and what she's doing to educate other vets. So where should we begin, Dr. Rubin? Should we go right into ozone?
Let's do it.
All right, great. So you have a lot of experience with, I'm just curious, this is my first curious question. You have a lot of experience with domestic and farm and exotic animals. So the whole gamut, rabbits, turtles, goats, sheep, llamas, camels. So have you done ozone on all of them or just dogs and cats? I'm just curious.
Oh no, all species of animals.
Yeah.
Kangaroos, hedgehogs, the sky's the limit. When it's a mammal or even a reptile or bird, ozone can be utilized for all species.
Oh, that's so cool. So do you have any weird stories about whether it's exotic or, honestly, even domestic, any crazy weird stories about ozone?
We call it rectal ozone, right? When we administer it through the rectum. But what do you call it when you do it to a reptile? They don't have rectums, they have cloacas. So we call it cloacal ozone. And it hasn't really been deemed a term yet, but you can certainly utilize it that way in reptiles. And I'll be presenting this year at a couple of different universities. One of my topics is exotics and ozone. So I'm very passionate about that. It can be utilized so many different ways, and it's such a unique modality, and it's so functionally approachable for these different species. Stories that come to mind, well, just thinking about trying to do rectal ozone on a hedgehog, that's not really an easy task, but it can be done, but with difficulty and sedation most likely. But there's other ways to get ozone into hedgehogs as well. So if you can imagine all these different critters that I've attempted to, I don't want to say experiment on, but utilize ozone on, it's certainly been a fascinating journey.
Well, but you could say experiment on, because really at the end of the day, all you're experimenting on them with is oxygen, really. It's like the safest darn thing you can imagine, really.
Right.
For those folks that aren't aware of ozone, please be aware of it. It's basically, we can get into science and, what ozone is actually literally, but it is, you're infusing oxygen, concentrated oxygen, which has a lot of wonderful health properties. So can you tell us maybe just a little bit of being nerdy about what ozone is, why it's different than just, regular oxygen we're breathing, and then what it addresses and why?
Certainly, yes. You have to use ozone with respect because there can be toxic components to it, but it's considered hyperbaric medicine. So ozone, just to give you the Reader's Digest version, ozone is an O3 molecule. It's an oxygen 3. But it's a very unstable molecule. It has 2 bonds on one side, 1 bond on the other. That 1 bond, if people understand that, is very unstable. So you're left with, when ozone hits air or even in the system, the O3 molecule will break apart into an oxygen O2 and an O1. That O1 molecule is very unstable and likes to latch onto things like viruses and bacteria, cancer cells, pain cells, and it eats them up. It gets them and it destroys them. So you're left over with oxygenation, superoxygenation, and those damaging cells are now gone. So it's a pretty cool modality to use, pretty safe once we train the doctor or the pet parent how to use it, because we want to be very careful on how we administer it. There's many ways to do that. And the one that comes to mind is the breathing. We want to make absolutely certain that we're not breathing in ozone unless it's going through an oil diffuser. So that's something people need to understand. And also when they're utilizing ozone, that they're not leaking ozone or breathing that in to cause irritation to the lungs.
Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also, down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show.
Yeah, very good point. So I literally just had an experience with ozone yesterday. I go to a biological dentist, and before we start, I gargle with ozone water, swish my mouth out for 60 seconds, and then I do it at the end. And that same dentist uses ozone if there's ever a filling to clean that spot out and get it really, sterile. And then I get a toothpaste that has ozone in the oil, in the coconut oil, or I think it's coconut oil. And I love ozone. I also used to use it in my pool. So when my past home had a pool, so I didn't want to use all the chlorine and shock. They call chlorine shock for my dogs. My dogs love to swim, and Labradors. And so I had this big unit that ozonated all of my pool. So all of the water 24/7 went through an ozonator. So I can attest to it. It's great stuff. And then the dentists, when they do use ozone, they use they put a suction, tube in your mouth to suck up that gas.
Right.
Yeah. It's a trippy thing, but it's not dangerous if you know what you're doing.
Oh, yeah. No, going to a healthcare professional that's been appropriately trained in ozone therapy is imperative. You don't want to just go buy an ozone machine off of Amazon or even Alibaba without knowing what you're doing. And you also want to make sure the quality of your ozone machine is there. You want somebody who's selling ozone machines that has experience, right, and training as well. So it's not just something you should just jump into willy-nilly. It's something that you should really investigate. Companies such as ours do trainings for people, for pet parents, for veterinarians. We're on the lecture circuit. I'm in the process of writing a textbook for veterinarians that should be out by the end of the year. So educate yourself on it. It's not just something you want to jump into, but it's certainly a fantastic modality for so many different things. It can be used so many different ways. When you're saying the ozone dentist, we use it in dentistry and pets as well. And yes, in the human world, when they infuse that gas into the pocket of your tooth, a lot of times they'll have a suction. We're working on things like that. We have them out there. There's human devices. And that's where I kind of come in. I've been doing ozone therapy for 15 years and just love it. And every single company out there was designed for human use only. It was all human. It was human machines being sort of retrofitted for animals. And about 3 years ago, I went to several of those companies and said, hey, I've been doing this for years. Can we do something specific to the animals? Can we get these devices to fit onto our animals' faces, not using the nose cups that people have? We need something for the animal's face. We need specific equipment for flushing wounds or getting that ozone to the animal and having the practitioner actually deliver it with ease to the animal. Well, basically, I was told maybe you're not thinking straight. And so I decided, you know what? Why not just go out on my own and do it? It was a big nut to crack, but I have redesigned every single piece of equipment for the ozone specific for the animals. Even my ozone machines are specific. I've done away with a lot of the plastic that's being used on them, the three-way stopcocks, the one-way valves. So I've made it, my goal is to make it so easy a monkey can do it. Oh. And that's what I've done. We've recreated ozone specific for animals. I'm the only veterinarian that owns an ozone company currently. There are other veterinary companies out there, and they've done wonderful jobs with education and trainings. But I really wanted to get more specific and hone on even deeper into this so that our animals could benefit from ozone therapy as well.
Okay. So tell the folks that don't know a lot about ozone, like the 3, 4, 5 really top big top uses and benefits from an ozone treatment?
So ozone can be used in many ways, but probably the easiest way people start out is with rectal ozone. And it's a small catheter that gets inserted right into the rectum. We want to use silicone because that is ozone degrades everything pretty much.
Yeah.
Eats into rubber, plastics. So silicone is one of the choices that we use. However, we've kind of discovered there's some other things. Certain types of Teflons can also be used. Quartz, things of that nature, titanium. But the silicone catheters that we use are the human catheters. And those we gently place that in the rectum of the pet. We use a olive oil or an aloe vera. We don't use any kind of petroleum products or kiwi jellies. We want all natural going in because ozone will absorb up into that gut. And when you place that rectal catheter directly into the pet, it goes right through into the transverse colon and hits the liver and detoxifies the liver immediately, which is wonderful for cancers, for autoimmune problems, for bacterial or fungal infections. It's a nice way to get the ozone in systemically without causing any kind of pain, discomfort, and also cost to the pet owner. It's a very easy, inexpensive way to get ozone delivered immediately. There are other ways to get ozone.
No, I'm sorry, I didn't mean to interrupt, but so that's how to get ozone in. Talk about the antifungal, antiviral, antibacterial. Let's talk about all that and what we're using it for. Very specifically, the biofilm. Like why? Like you got a layman out there. It's like, who cares about ozone? Why would I even need that? I don't need that. It's not necessary. Why are we using it?
Well, even people that are not sick are using it to feel better because you're just oxygenating your body and getting rid of all those nasty free radicals and toxins in your system. Yeah. Because even if you feel good, you still have toxins in your system. Not everybody can eat clean 24/7, although some of us try. You still have toxins. Your microbiome can be off. Those are things that are important. Even somebody who just has diarrhea for a few days can utilize ozone. And I need to make a disclaimer because I'm talking about animals. I have to be real careful because I don't treat humans, but I want to make sure that people know there are human doctors out there that do this as well. And they're very skilled and very educated. So if you have a disease or a disorder, for example, Lyme disease, which I can say personally, I am a Lyme disease survivor of 30 years, and ozone is really what helped me through the process. And so we can do that on our animals as well. Lyme positive animals, cancer, wonderful for cancer. Many different ways to administer ozone too, Rob. You were saying, what are the ways of doing it? So rectal is the easiest. We can actually ozonate sodium chloride or saline fluids and give that to our pets as a subcutaneous injection, which floods the area under the skin and will literally go in and hydrate the pet, for example, especially kidney patients, even pain management. We can use it for pain management because it's basically hydrating those tissues and delivering oxygen or ozone that way. Yeah. One of my favorite treatments for mold, because there's really nothing else out there. I find that I do a lot of second opinion work, and I can't say enough good about some of the new testing, the microbiome testing that's coming out. And VDI Laboratories has done a fantastic job. I'm just going to plug them because without them, I have not had the answers that I have received over the last year, being able to diagnose some of my patients that are chronic. I have one dog that went to a clinic 11 months. They put this poor animal on antibiotics, 10 types of antibiotics. I'm not kidding you. I have the records to prove it. They did culture and sensitivities at a regular laboratory. Those culture and sensitivities do not check for all the different microbiome out there, nor do they catch funguses or molds. Yeah. With this microbiome testing now that we're doing, which is absolutely fantastic, it was able to detect that this was not a bacteria at all. In fact, it was a mold. And guess what treats mold? Ozone. Yeah. Within 6 weeks, we had this entire infection cleared up. This dog, and the caveat is the other vet wanted to amputate the dog's toe because they could not get an antibiotic to work. Horrifying. Thank goodness these people had the wherewithal to know to look for somebody who did ozone therapy. And actually, I'm presenting that case at AHVMA this year. It's such an exciting time to be able to utilize these lovely tests that are coming out. Microbiome, fecal transplants, also excellent to combine with ozone therapy. So it's an exciting time. You can tell I'm pretty passionate about it because we can fix these animals now that have been going on and on and on. And we've really screwed up that dog's microbiome by giving it so many antibiotics. We had to go backwards. Ozone therapy, rectal ozone soaks for the local. We actually did some ozone gas injections into that area as well. Probiotics, Gussie's gut to get the fermentation back in that animal's gut. I mean, so many different angles. And this is what I'm so passionate about, is teaching other veterinarians how to utilize these products to get their patients better, not with Western medicine, but with other types of modalities now that are out there that actually work.
Yeah, no, that's great. So ozone is additive, not subtractive, because, for example, like antibiotics, you have this great benefit of killing bacteria. Then you have the downside of there's a breakdown, sometimes a pretty clear destruction of the microbiome. So there's pluses and minuses to it. But ozone is basically just additive when it also helps address an issue, like, for example, a bacterial infection. True?
Yes, we can actually treat a lot of these cases that people are giving antibiotics to animals with ozone and fecal transplants. And it's the way of the future, folks. I mean, even the AVMA is on board. There's a website through AVMA. You can go right directly to them. Overuse of antibiotics in animals. And more people actually have died of anaphylaxis to antibiotics than actually getting treated with them. 5 million folks. Animals as well. We're just killing their gut with these antibiotics. I'm not saying we shouldn't use them. I'm saying we need to use them judiciously and carefully and have some testing to back it up. This microbiome testing that we do actually will select antibiotics based off the bacteria and funguses they find in the gut or on the wound, because it's not just a gut microbiome they're checking. And it will tell you, is the animal resistant to an antibiotic? Is there DNA or genetics behind that antibiotic that the animal may have a resistance to? So it gets deeper than that. Gone are the days where we should just be throwing antibiotics to animals. We need to really investigate what the problem is and figure out how to get to the root of the problem without destroying the animal's microbiome. Because when you do that, guess what? It leads to other problems like cancer and autoimmune diseases. We've now just ruined their immune system by doing that.
Yeah, which is the last thing you really want to do when you're already, behind the 8 ball in your pet's health. That's an exact time when you want them to have the strongest immune system and rebound and get well again. It's
right.
Yeah, horrible time. So the other uses for ozone would be like dissolving biofilm in the rectum. So, it's the GI tract. So just tell us a little bit, we'll get a little tiny bit gross and nerdy, but you stick a tube up the rear end, you put ozone gas up there, and what happens?
Really no pain at all, but it does make them want to go to the bathroom most of the time. It's actually a really cool way to get animals that are constipated to deconstipate without using enemas or anything injected into the rectum other than just ozone gas.
Yeah.
And so a lot of animals, especially in horses, it's really cool because you'll see them just go, they actually take a big sigh like, oh, thank God you did that. They feel really good. I mean, who wouldn't want a blast of oxygen in their system, right?
Yeah.
And so it's kind of an immediate effect, but we give it to, all animals can have it. It's probably the safest and easiest way to administer ozone. It gets deeper than that. Ozone can be utilized so many different ways. Aside from the rectal or the subcutaneous, we can go deeper. And one of the ways we use it, especially for our cancer patients, we take some blood from that patient, a small amount. We actually take the blood and ozonate that blood. So we'll put it in a syringe. We'll add ozone in to another syringe. We go back and forth and mix it. It's really cool because you can actually see that blood sample turn bright red. So the blood sample gets super oxygenated.
Yep.
Now, there's other ways to treat that as well. There's higher levels like photobiomodulation or UVBI, which I'll go into. Also, just calling that major autohemotherapy, when you ozonate an animal's or even a person's blood and they give it back to the animal.
Yep.
We take the blood sample, we infuse it with ozone saline and some ozone gas and give it right back to the animal via a butterfly catheter. They don't need to be hospitalized. It's pretty immediate. And the animal feels great most of the time. Now, I will say this. If you have an animal that's really, really, really sick and you have a heavy duty bacterial infection, you can get something called a Herkimer reaction. Pretty rare, but it's there. And it's like an anaphylactic reaction because the bacterial kill can be so overwhelming. So we want to make certain when we do these types of modalities that we start gently and work our way up. We don't want our patients getting sick from it. We want to assist them to feel better. So there's where the training comes in, right? Knowing the doctor understands the patient, understands the concentration of ozone, because it gets deep, right? There's different concentrations, there's different amounts to give different patients. All those things come into play. But when you do something like major autohemotherapy, and I'll take it even further, when you add a UV component to that, meaning you take that blood sample that's been ozonated, you run it through a vet lumen or a hemolumen machine. There's different wavelengths that you can use on that particular blood sample, right? It goes through the wavelengths, and those wavelengths are specific to treat certain things. It goes through a cuvette into different syringes. And then we take that sample, we can add things like biotin, which is a sea mineral, which helps potentiate the ozone even more. And then we inject that back into the animal. That works as an autologous vaccine against their own disease. You've used no harsh chemicals. You've used no chemotherapy. You've used the animal's own blood, so there's no donors. Totally safe, totally healthy, not too expensive either to the owner. And it's a fabulous modality for cancer. Again, pain relief, allergies. Love it for allergies, right? Great for any of these itchy dogs, which also the ozone is fabulous. We sell ozone showers. People can actually hook it up to their shower and bathe their dogs in ozone. You were saying your swimming pool, which I love. I think that's great. I usually tell people to get the saltwater pools, but the ozone pools would be even better. Love the idea of that. So you can bathe them in ozone. It works fabulous on bacterial, fungal, mold on their skin as well. It's just super oxygenating. I mean, what's the biggest organ on our body? Skin, right? So you can bathe them in it. And those are the more detailed. We use it in acupuncture. You can fill a syringe with ozone gas and put it into the meridians so that you're driving the acupuncture, the ozone into that meridian and oxygenating that area on top of stimulating the neural pathway. It's just a bonus any way you slice it, right? We use it around tumors. You can actually, if you have a localized tumor, they call it circling the dragon. That's an acupuncture term, where we put little bits of ozone around that tumor and we watch it shrink. It's super cool. It takes a little bit of time, maybe 6 to 8 weeks. I've had dogs, I'm treating a dog now with a mast cell tumor on its front leg. It's a big, hard tumor. The other vet said, no, amputate the leg. Dog doesn't have metastasis. The dog is walking around feeling good. Why would you amputate a leg because it has a mast cell when you can inject ozone around it? Do rectal ozone. We also do something called hyperthermia on it, which is a heat process that cancer doesn't like heat. It'll help shrink that.
Or cold.
Or cold, right? And so like the SanaWave. SanaWave is another wonderful modality for cancers. But these are things, I mean, we hear these things, they come into my clinic and they're documented in the medical records. I can't believe it with my own eyes. Recommend amputation on a tumor that's about the size of a golf ball. That's not an osteosarcoma, by the way.
Yeah.
This is a soft tissue mass.
Yeah.
And so,
Crazy.
and they're shrinking, which is great. So it's so awesome to see this type of medicine coming out. I'm sure some of the oncologists are a little nervous about it or they don't understand it. I've had a lot of them come back and go, we don't know anything about it, but go for it. It's not going to interfere with your chemotherapy, your radiation. None of the ozone will interfere. We just tell people don't do it on the same day, but it's also a wonderful modality just for supportive care if you choose not to do anything, or if you do choose to do something like chemo or radiation, it can only potentiate it and make it better.
That's great. Well, yeah, even Dr. Marty Goldstein has talked to me about, he's worked with ozone and osteosarcomas, and, it may not be a cure for your dog. I mean, there's no exact one size fits all for every single dog. And then, to your point about making sure somebody qualified is doing it, if you can't give a Great Dane the same, or a Chihuahua the same dose as a Great Dane, and you can't give a sick Chihuahua the same as a well Chihuahua. All these things have to be taken into account.
Exactly. And it's individualized medicine, right?
Sure.
I don't see
50 people
a day. I know. I don't see 50 people a day. I don't want to see 50 people a day. If I see 5 people a day, that's a lot to me, because each one could be 2 to 3 hours of talking to the owner. Education is the key. It starts with the gut, right? I mean, it's a no-brainer, but people go, how did my dog get cancer? Where did he get cancer? I'm like, just look around, folks. Okay. Look at all the food, the soil it's grown in. What type of vitamin deficiencies do your pet have? Because your gut's not absorbing those nutrients. It starts off with what's in your home. What toxic things are in your home that your pet's exposed to? I love this one. People have Glade plugins, right? Oh, not that I don't want to get shot by the Glade company, but think about that. It's right there on the ground next to an electrical outlet where your pet is right there smelling it, right?
Let's just say this. Right. It's not exclusive to that. Yeah, it's not exclusive to that brand. Any petroleum-based, chemical-based scent, that includes things you spray on your couch and your cushions to make them smell good, your fabric softeners, folks.
Yep. Dryer sheets.
Yeah. Yep. Usually if it stinks, if it smells like, pretty these days, it's usually not great for you. And and it's horrible for your dog. And your dog's nose is always right against it. So new carpet padding, the chemicals off gassing right in your dog's nose, horrible. Carpet cleaning, we could go on and on.
Yeah, but people ask me, well, how did my dog get cancer? I'm like, well, look around, or smokers. I love it. I don't smoke in the house, but you smoke outside, and guess what's on your clothes?
Yeah. The real question these days, it's sad, but the truth is, how does your dog not get cancer? The question is not to ask how they get cancer. That's the default these days. Literally, we've now gotten to a point where 50% of dogs are getting cancer, and they're getting it younger than ever before. Yeah. How does a 4-year-old and a 5-year-old dog get cancer? I mean, that's just horrifying. It used to be 10, 11, 12, which is still young in my opinion.
Right.
So if a dog got cancer, if a dog got cancer at 15, they live to 16, 17, that's at least a little something. But this short life is already too short for everybody's happiness. We're all, including your dogs. Cutting it even shorter doesn't make any sense. So how does the ozone, just explain like why does cancer not work? Does not, what is it about ozone that makes cancer
inactive,
go away, or get it?
Yeah.
How do we address cancer with ozone? Why do we think that works? Why is ozone even helpful?
Well, and just not to digress, but just genetic breeding. I just want to mention that, because we are breeding all these crazy breeds, right? Yeah. And guess what it's doing? It's diluting our DNA in our pets.
Yeah.
So think about all those crazy breeds, the doodles and the wolfadoodles and the labradoodles and the Frenchies. I mean, it's out of control what's happening. The early spay and neuters, just to digress, a couple of other things. But to answer your question about ozone, ozone is very powerful. It's in a super oxygenator. Cancer does not like oxygen, hates it. And so they're enemies. They just, bam, the ozone hits that cancer cell and it basically just denudes it, right? It deactivates it. Now, if you have osteosarcoma, we use it in osteosarcoma. I've used it in many cases of that, will actually inject the gas around that tumor subcutaneously. Ozone goes where it needs to go. That's the beautiful thing about ozone. So, when I took my acupuncture schooling years ago, we have to take these tests and we're nervous and they're practicals, and God forbid you miss a point, you've got the teacher standing there. They used to say, if you get it kind of in the right spot, you're still going to be okay, right? You're still activating that neural pathway. Ozone is a really cool modality because when you inject it, it literally finds where it needs to go. So I've seen this. A lot of people will do it into joints. They call it prolozone, right?
Yeah.
People will actually inject. It's a
prolotherapy.
Right. It's prolotherapy. It's procaine with dextrose. It goes in and attacks that inflammatory response. Yeah. The ozone goes in and it super oxygenates it. I've seen that where people do it right in the joint. I don't even do it in the joint anymore. You really don't need to sedate your pets to get ozone into them.
Yeah.
You can go right by that. And we teach that in our class, right? We do teach the prolozone technique because some people they still have their head wrapped around that. But the newer way of thinking is inject that ozone around that inflammatory area and it's going to find its way. It's going to get in there and do what it has to do. So it's a kind of a newer concept, right? We don't have to inflict as much pain. And that's something I think a lot of the holistic vets too also really look for. Less sedation, less pain to the patient, right? It's super important. A lot of holistic vets don't even have anesthetic in their clinics. So we try to find ways to deliver ozone without having to do all the sedatives and things. And really, you don't need to. Ozone does not need a sedative to be delivered, even around a tumor, because if you use the proper concentration, it won't sting. So there's where your professional comes in, right? If you use a 65 concentration versus a 15 concentration, that animal's going to go postal off the table, right? That's a high concentration. So you work your way up, but it does. And it's pretty cool because you will see that ozone. Literally, if you inject it into an area, you'll see it just kind of travel up and go to that area. And we actually warn owners after, like, hey, if you feel a little crackly up here, don't be alarmed by that because that's where the ozone needs to go. So it does its job all on its own. It's pretty cool.
Interesting. Yeah, that's really cool. Well, the reason is somebody says, well, how does that happen? If you give the body what it needs, nutrition, good microbes, oxygen, the things that are, just innate and necessary for us to survive, we're administering in this particular case, ozone, oxygen in the form of ozone, but it's still natural, just a concentrated version of oxygen. That's clear to everything I've seen over 25 years of treating with my dogs, also with ozone. It's just magic. It's like somebody who's been starved of nutrients who gets really good meals.
Yep.
Like, how do those nutrients find the right places to fill and like satisfy and get that person healthy? I don't know, but it does. And it's exactly the same magic that happens with things like oxygen.
Right. And, we can use it topically. We use it on wounds. It's fabulous for wound healing. We have an oil that we supply to people. You can use it in the mouth. They call it oil pulling in people. Most people know what that is, but in case they don't, it's where you take oil. Some people use coconut oil because it's antibacterial. You actually put it in your mouth, swish it around for 5 to 10 minutes, and it kills the biofilm on your teeth that create tartar and inflammation and infection. So you were saying earlier, your dentist washed your mouth out with ozone water. Why did they do that? They disinfected it without using things like chlorhexidine or some of the more toxic sanitizers, right? It's just ozone water, but it kills everything. It's amazing for surfaces. We actually sell a little sprayer. It's really cool. You can spray it on your counters. It's a little bottle. You put tap water in, and it has a little tiny ozonator in it, and it's got a little USB port. We spray it on the counters. You don't have to use toxic chemicals anymore on your counters. It sanitizes your counters. It sanitizes your fruit and vegetables. You can actually spray the ozone water directly on it. I really like it now. I've been using that instead of using alcohol on my patients because alcohol can be very off-putting. I'll use the ozonated water sprayer when we collect blood from a pet. Even on the horses, a lot of times when we go back and put the rectal catheter in, we'll clean the area off with the ozonated water. It disinfects those areas. And so people
Yeah.
understand about alcohol, because everybody has this hang up about alcohol. Oh my gosh, when they give a shot, they put alcohol on. Alcohol has to sit on the surface for a minimum of 15 minutes in order to do its job. And even then, it doesn't catch everything.
Yeah.
Most of it's psychological.
Yeah.
Most doctors use alcohol before a shot because people have this expectation of putting alcohol on something that's going to kill everything. And
Yeah.
that is not the case anymore. Our microbiome has changed. We're exposed to all kinds of different bacteria on our skin. Alcohol doesn't cut it anymore. But the ozone water has been a really nice addition. And so people keep these little ozonated bottles of water around. They spray things. They can spray their vegetables. I like it. Like I said, when I go to pull blood from my patients, either jugular or through the leg, I'll spray the water on it. It's a very quiet spray. It's not off-putting. There's no heavy-duty odor to it, because ozone, just in case people don't know, has a very off-putting odor if it's very strong. And that's where you want to be careful, because you don't really want to smell ozone when you're using it.
It smells clean. It's like a rain shower right before it rains. It's
right.
That's
Exactly.
ozone.
Yep. That's exactly what, after a rain, you smell that real, smell petrochlor, petrochlor smell, they call it. That's ozone afterwards. That's cleaning. It's cleaning the environment. That's a natural way that our makers have cleaned the environment after a rainstorm. There's ozone smell.
Well, also to your point about the alcohol, I mean, look how many deaths and secondary infections we get from being in a hospital. That's all they use.
Right.
It's alcohol, and of course other chemicals. And still, it's not good enough. It's like, they're resorting to natural things, like whether some do ozone, others do this really intense ultraviolet. Machines come in, they roll them in. I mean, that's like the sun. That's all it is.
Right.
Go figure. But, these are, of course, tens of thousands of dollars, these machines, and you can't look at them. It's kind of like rolling the sun into your office, and then it goes off for 5 minutes and then it stops. But I want to explore the cousins of oxygen, all in the oxygen therapy categories, the cousins of ozone. So, I have amazing experience personally with my 14 to 16-year-old lab buddy who I used to have, and with hyperbaric oxygen. And I want to talk about microbubbles, if you can talk a bit about that, the TheraClean machine. And I also want to talk about anything you do with hydrogen peroxide, anything just adjacent to that. Do you have any comments on those? Oh, frozen. Great.
All those things that you mentioned, what are they? They're oxygen, right? When you think about microbubbles, bathing your pet in ozone, I actually have an ozone shampoo coming out, a clean pet shampoo that should be out on the market by the end of the year. I'm super excited about it because I've put out shampoos with CBD in them, and which were organic saponified coconut oil bases with essential oils. All these are going to have essential oils and herbs in them. So again, we're combining things together, right? The things that you mentioned can be a combo. Microbubbles in the bathtub, excellent for the skin, excellent for wounds. We actually use the bathtub. We use the ozone as a hydrotherapy, especially in horses. Great for cuts and wounds, flushing. We use it in dogs and cats. You can hook up these little ozone showers now, which we have on our website, where you can actually take and flush the wounds out really nicely, not just aside from bathing as well. Now, I will say this, those ozone showers are not as strong as when you put it through an ozone machine. The ozone machine can ozonate water to a pretty high level, and we use that in wound flushing as well. You can ozonate saline. Saline's wonderful for flushing eyes. You don't want to put water in the eyes because you want the 0.9 saline, but fabulous for eye infections, right? In horses, we can actually go into the nasal lacrimal duct. There's a little catheter we actually put in the nose. It goes retrograde up and flushes the eye out. It's a super cool thing. That you may need sedation for. It depends on the horse. But getting rid of corneal ulcers, fabulous way with the saline. Anytime you flush a wound with it, I think you asked me about what was the other? You asked me about microbubbles and
Hydrogen peroxide.
hydrogen peroxide. So it's basically hydrogen peroxide, right? So we can treat ear infections with ozone, right? It's great for these chronic ear infections. What we do is we hook up a little stethoscope that delivers ozone, and it's actually not really ozone, it's the ozonides, which are hydrogen peroxide, because you don't ever want to pump straight ozone gas near the face. I think I mentioned that earlier. So what we do is we hook that stethoscope up to the ozone machine. We have another port that goes through the stethoscope, and what it does is it sits in olive oil. The olive oil catches the toxic gases and leaves hydrogen peroxide behind to treat that ear infection. So it goes right down into the ear canal by the eardrum and kills off that ear infection, and it's left with hydrogen peroxide, which is wonderful for killing viruses, bacteria, right? And we can also use it nasally. We do the same thing. I've developed a mask. It looks much like an anesthetic mask for the animals, but it's been all recreated with silicone so the ozone doesn't degrade the rubber. Yeah. And it fits right on. We have a special little piece that's been designed by an engineer that hooks up right to the ozone machine that delivers gas to the animal, but goes through the oil, creates a hydrogen peroxide treatment, kills nasal fungal infections in the nasal capacity or the nasal chambers, treats nasal cancer, can treat nasal parasites, nasal infections. I mean, it's fantastic. So ozone can be utilized to break down into hydrogen peroxide treatments, if that makes sense.
No, yeah, that's great. That's amazing.
I mean, it's incredible what it can do, really.
Yeah, I mean, it's all good things live in oxygen. All bad things cannot afford to live in oxygen. And so just something to be thinking about. It's a great tool in the tool chest.
Yes.
And if you have a vet that doesn't have this as a tool in their toolbox, then you're kind of limited to chemicals and or antibiotics to address issues.
Right. Well, and on our website, on our ozone website, we have a list of veterinarians throughout the country that utilize ozone therapy. So if somebody's looking for someone, because we get calls, that's the Regenozone website, www.regenozone.com. On there, if you search ozone veterinarians, it's right at the top bar for a search. It will come up with a list of veterinarians. Now, I will say this. If you know a veterinarian that's not listed on there, please email me because we want to put them on there. We're trying to educate the population about this. And the more veterinarians that are on board with it, the better off we're going to be. It's a really hot field right now. It's kind of like laser was 20 years ago. Remember that? When everybody was like, ooh, what's that weird thing going on? I had a laser machine. People would drive for hours to get to me. And other vets were like, no, I tried to go into other vet clinics and go, guys, this is absolutely amazing, this modality. And sure enough, nobody listened. But now guess what? Everybody has one on the block, right? It's great. And I think this is the direction ozone's going to go in. I think people are going to become so educated and see the results and the efficacy of it. And they're going to feel so much better that it's going to spread. It's just how it is. And I think the world is ready now for some more holistic treatments rather than all the Western treatments. Don't get me wrong. There's a place. That's what integrative medicine is for. But I think people are reaching further now. They're not just going to listen to the general. You have to be your own advocate for your medical care. And that goes for people and animals, really.
Oh, yeah. Yeah. Well, this was the original medicine, let's not forget. And then we got away from that and we got into more of what we now call Western. And, now we have specialties, and for both human and animal, each of the specialties are very expensive. They don't talk to each other. So they're not coming up with health. All they're doing is in my opinion, they're playing a whack-a-mole game. They're just pounding down one problem after the other. It just racks up vet bills, and the dog or person doesn't really get healthy as a result.
Right.
So, I put my faith and my health, which is incredible. I'm on 0 drugs. I'm 53, never been on a drug in my whole life.
Wow. Excellent.
Everybody seems to be on some series of drugs these days. I
Yeah.
have no idea why. But I'm very proactive, and I have the right healthcare team behind me, people who can see beyond a bottle or an injection or pill,
Right.
and they can give you true health and build your health up as you're getting through any illness. You don't have to knock yourself down.
Right. And it's funny you say that, because what's happening in the veterinary schools, and I think even in medical schools, is they're not teaching the youngsters how to diagnose and treat without utilizing something they can just pull off the shelf and get an immediate response to.
Yeah.
And what I'm finding is, I mean, if you go to your veterinarian and you've gone there 4 times and they're doing the same thing after 4 times, if they're sending the same ear medicine home or the same antibiotic home, or they're continually giving that same allergy injection, and you're just right back in there every 4 weeks, there's a problem, folks. I mean, they're not getting to the problem. Cha-ching, okay, it's going to cost you a fortune for some of these drugs too. At what point do you say, you know what, this isn't working, we need to look into something else? And I find that a lot of times now the schools are teaching these guys how to just grab a bottle off the shelf, and I won't mention the brands.
Yeah.
My dog's itching, so let me just give him this shot that works for 6 weeks, and then you can come back, you could go on this allergy medicine that costs a fortune that blows up their liver over time. I mean, think about these things. There is no magic bullet.
And when you come back to that vet, to a vet with a blown out liver, as you said, they shrug their shoulders. There's nothing they can do.
Right.
Like, what are they going to do? What are they going to offer you? Follow the logical steps here,
Yeah.
And so it's almost like, what it reminds me of, Dr. Rubin, I had koi ponds, and I had these in Nevada, in the desert. Not exactly easy to have healthy koi ponds. I had beautiful, healthy koi ponds, but they said you can do concrete, and they'll be beautiful, really gorgeous concrete, or you can do the lined and just go the natural route with the plants. It's much harder at the beginning, but once you get it going, it takes care of itself. And we won't get into all the details, but that's what we did. Fast forward, I had a magazine want to take pictures of, how these beautiful koi ponds could grow in the desert. And they were not concrete, because the concrete folks said, you're going to have to constantly put these inputs in, these chemicals and all these different, they're just chemicals to keep keep the water clean, to keep bacteria from growing. And it just at that time, it was seductive enough where I considered it, but I thought, this doesn't even make any sense. I'm now, it's like, it's all these parallels to like agriculture and all the inputs with agriculture. And once you get into that system, it's very hard to get out.
Right.
It's very hard to get out. And I just think of it in easy terms of like, that was me with just my koi pond. And then once you get into like chemical interventions all the time with your dog's health, you're pinging back and forth like a psychotic person. And we talk to these folks all the time. These customer inquiries come to us, and these people are at their wits' end because they have jobs, they have families, they're getting bled slowly. And it's also genius because the vet visits are a little cheaper. Here's my experience. The vet visits are $85, $90 something dollars. The holistic vets up front are way more in demand, always busy, take fewer appointments, have longer appointments, 1 hour as opposed to 15 minutes, but they charge $300 and they're cash only, or some are $600. And so the untrained person, the untrained mind says, whoa, that's way too much money. The truth is the other way ends up being way more expensive.
Yep.
You got it. Yeah, I've had these holistic vets. I'm telling you, folks, I've had holistic vets for 25 years. They are the key to freedom. They don't want you to keep coming back. They want to free you and your animal, and they want to see wellness. So if your focus is on wellness and not just disease intervention and constantly, hammering down a bacteria or a virus or something, you're going to come out much cheaper in the long run. Believe me.
Prevention
Sorry,
is worth Oh, no, you're absolutely right. And, I get that. You're so expensive. Why are you so expensive? I'm like, yes, but you only have to see me once a year. And maybe up front, it's more because honestly, why didn't the other veterinarian do these tests in the first place or recommend these things in the first place? Had they done that, you wouldn't be backpedaling now to undo not only the liver damage, but the itching that never went away.
Yeah.
Right. I mean, so yes, prevention's worth a pound of cure. I tell that to all my clients. Diet, less vaccines, more mindful medicine, all these things come into play. And I mean, really, what's the ultimate goal? We want our pets to live forever. I mean, who doesn't want their family dog or cat or hedgehog or whatever it is to live forever? That's my biggest beef on the planet is our pets don't live long enough, but we can certainly try to do something about it to make that happen. And going to a holistic vet, most of us are like-minded, right? I mean, the American Holistic Veterinary Medical Association is a fabulous organization. That's another website, ahvma.org. You can go on that website, put in your zip code, and there is a list of veterinarians around the world that treat with holistic medicine. So gone are the days where you can't find anybody. It's spreading because the Western vets have given up. They're like, we can't do anymore. So people get to a point where they're like, well, we got to do something. This is our baby. What are we going to do? So they head off to the holistic direction, which is great.
Yeah. I talked to a vet in private one time that said she was holistic and she worked with a traditional vet in her office that always carried around two things in the coat pocket. And I believe this story will make sense, but I believe it was an antibiotic and it was like a antibiotic and a
steroid.
Yeah, steroid. Thank you.
Know it well.
And it's just there because they could just like take care of an issue really fast.
It's a Band-Aid.
I was mortified. I mean, the acting like these things have no negative side effects. Forget side effects. I'm talking about negative side effects. And just capriciously grabbing these things is like, I don't know. It's like, just the over medication of our world is just so silly and it's unnecessary. But it just takes a little bit of effort. And I don't understand why somebody wouldn't want to look into health and invest the time and energy into it and not just say, and I know that some people go into a vet's office and they say, just make it go away. Whatever you have to give it in quotes. Yep. Just give it, and that's the way some people are. And there's nothing I could do to change that. But the folks that watch something like this, especially if you're watching and listening currently right now, you're not one of those people. And you're inquisitive and you're curious and you're learning and you're looking for ways to build up health, not just tamp down illness.
Right. Absolutely. I tell people, I see a lot of animals in pain. That's one of the things I see because of the acupuncture. And I tell them up front, you've got a chronic condition. I'm going to need to see you most likely for the next 6 weeks. Acupuncture isn't just a one and done, right? And people go, 6 weeks, that's a long time. Yes, it's a long time, but how long has it taken for the animal to get this way? So if you could commit to me for 6 weeks, and it may not be, if the animal's great after 3 sessions, maybe we pull it out for 2 weeks. Most holistic vets aren't there looking for you to come in all the time. We have a set idea of how long it's going to take to fix something and get you in and out. But the problem is we want this. It's like everything's instant now, right? Like, you text somebody and you want to hear back from them right away. It's an instant society. And so our bodies don't heal that way. It takes time. And so it's not just a one thing. It's not a one and done. You need to change your environment, your diet, your mental status with that animal, right? Anthroposophical medicine. Again, I've mentioned that falls under the realm of mistletoe, which I think we'll touch on. It's mind, body, and spirit. That's so huge in keeping your health, right? It's a huge component of trying to keep your pets healthy. And so coming into a vet office and just going and getting a steroid shot or an antibiotic, those days are long gone, right? That's how I learned. Okay, I've been in the field for 40 years. I was a vet tech for 13 years before I became a veterinarian. I worked for veterinarians that did that. They had a bottle of steroids and a bottle of penicillin. and out the door they went. And a lot of that had to do with the fact that they didn't have the education back then.
Sure.
There is no excuse for that kind of medicine anymore. Absolutely no excuse. And we shouldn't placate people that ask for it. It's our responsibility.
No.
We're doctors. We took an oath to make sure the animal is not suffering and continually suffering by just throwing a Band-Aid over it so they can go away and come back every 6 to 8 weeks to get more. Because in the long run, we're going to cause Cushing's disease, causing these, with these continual steroids, autoimmune diseases, all kinds of things that are going to liver disease. It's our responsibility to educate the client now. It shouldn't be where you just go in and you get your routine vaccines and out the door you go. And veterinarians are busy. I get it. But, at some point, podcasts like this are wonderful for educating people. I think it's important. The pet owner has to be the advocate for the pet. That's how it's going to be.
Yeah. Well, we're coming up on our hour. So why don't we end on mistletoe? Because that's the last thing you just mentioned. So give us a quick like people know mistletoe from Christmas. That's about what most people know. So tell us what that plant can do and why you use it.
Well, you don't want to obviously take the mistletoe that you're standing under by the Christmas tree and eat that. That's not how it works. Okay. And mistletoe, actually, when you eat it, when not prepared correctly, is very toxic. I'm talking about the injectable mistletoe. They've been using it in human patients with cancer and breast cancer, mostly in women, for years and years. Rudolf Steiner was the original father of anthroposophical medicine, mind, body, and spirit again. But mistletoe falls underneath that realm. And so mistletoe is a newer way of thinking. My partner in Brazil, who is a mistletoe expert, Dr. Claudia Costa, which I'm hoping you'll reach out to her to be on your program. She's a wealth of knowledge for mistletoe. She's just written a veterinary book on it. She'll be talking at HVMA here in September with myself. But what it does, it's an injection that we give 2 to 3 times a week, depending on the patient, depending on the concentration, the species. It takes about 2 to 3 hours for even the veterinarian to understand. I do consultations on that. I've written a white paper on it, so we go through all the protocol. But it's a fantastic modality to help with palliative care, slowing cancer down, eliminating some of the pain that is associated with cancers. And I have a lot of people now looking into that as another modality that works well synergistically with diet, ozone, IV vitamin C, all those different things we talked about, Santa wave, hyperthermia. It's another tool in the toolbox that can be utilized to help with cancer therapy.
Yeah. That's great. Well, and people could do research and people can start asking their vet or for a vet if they're interested in learning more about that. Don't go playing around with it.
Right. It is a prescription. I will tell you that. You have to get it through a pharmacy that a doctor has prescribed it because it's very specific. Different cancers take different species, different dosages. There's a lot of monitoring that goes on. It's just not one that a lot of people think it's just one shot and away you go. Again, not the case. It is something that is a lifelong treatment. If you choose to do mistletoe to the end of that pet's life, you will be doing mistletoe. So I want to make sure people understand that. It is an injection, not the oral. The lignans are too sensitive. There are some things online where you can buy for mistletoe. The injection is the best way to go.
Oh, interesting. Great. Yeah. Well, Dr. Jyl Rubin, this has been great. Thank you. This hour flew by. I really appreciate it. We talk most of the time about oxygen and the miracles of it. And I'm glad we did because it's like the lowest hanging fruit, the most, like I keep saying, additive and easy and affordable and it's just magical. And before you go for grabbing for a heavier tool, just take a look at oxygen, folks, and specifically, ozone, and you could look at the others too. But I've walked my talk here. I've personally injected hydrogen peroxide IVs. I've drank hydrogen peroxide, food grade, of course, for viruses. I've done all kinds of great success. I know what I'm doing. I have great doctors. And then I've done this with my dogs, and my dogs have had the most just vibrant, beautiful lives. And they don't suffer all of these crazy, chronic, weird things that, knock on wood, I'm going to knock, that it's like every dog seems to be dealing with. And so, it just takes a lot of interest at the very least. You have to be very interested, and you have to be inquisitive, and you have to start looking for the right people. And go to start at AHVMA, AHVMA.org, right? Or .com. Is it .org?
I'm so sorry. You cut out completely for like the last minute.
Okay. I'm sorry. There's a little bit of hiccup. We'll say goodbye in a sec, but AHVMA.org is where you can find a holistic veterinarian.
Yes.
Start there, look, see who's in your area, start making some phone calls, interviewing some people, and, start getting really involved in your pet's healthcare and your own.
Absolutely. Again, mind, body, and spirit. What's at the end of the leash radiates up to the person walking that pet.
Yeah.
So if you're healthy, your pet's most likely going to be healthy. It's really important. That transference of energy is huge. We want to make sure our pets are taken care of, mind, body, and spirit. Can't say enough about it.
Not only that, if you're in the same house with your pet and everybody you're sharing the same microbiome. If you're sick, the weakest among you is going to be pulling you down. That is a fact. So it looks like we might have cut out with Dr. Jyl Rubin, but look, thanks to Dr. Jyl Rubin. Thank you all for listening. Have a great day, everybody. Take care. Bye-bye.